The big question is, does regular sexual intercourse cause vaginal loosening or rather vaginal widening? The answer is no. Allow me to say that sexual intercourse is controlled first of all from the mind, and the brain sends signals into the hormones that plays a bigger role in sexual pleasure. Now, during sexual intercourse, or when the woman is sexually aroused, the pelvic floor muscles tends to relax. Normally, the pelvic floor muscles are supposed to be tightened in normal circumstances. But when a woman is sexually aroused, these pelvic floor muscles tends to relax. After they relax, the Bartholin's glands start producing the vaginal fluid to lubricate the walls of the vagina for easier sexual intercourse or for easier penis penetration. During this time, the vagina also relaxes and it expands, because we say that vagina is elastic in nature. It can expand and it can relax. Now, this means that every time when you have sexual intercourse or any time when you are sexually aroused and these pelvic floor muscles relax, then you tend to have a larger vaginal diameter apart from the usual diameter. When these pelvic floor muscles tighten at the end of the day, this vagina does not lose its shape from the previous sexual intercourse that happened. Ideally, there are only two circumstances that can lead to widening of the vagina. And this widening occurs in some literal change in a shape. Number one, and the main cause of vaginal widening is childbirth. When a woman is giving birth, when there are contractions, the walls of the vagina again relaxes to allow the passage of the child during birth. After birth, the normal structure or the normal anatomy of the vagina starts getting back to its normal, usual shape. This means for the first few days after a woman gives birth, the vaginal shape is lost and the vaginal diameter is lost. But with time, as the woman continues to recover, the shape gets back to its normal size. Number two cause of vaginal widening is the old age. Remember we said during old age, there is an increase in hormones that we refer to as estrogen. When the estrogen hormones are reduced, they causes the thinning of the vaginal muscles, hence making the vaginal shape or the vaginal diameter to be a bit big and to be a bit loose. This loosening of the vagina does not result as a result of continued sexual intercourse that this person has been having previously. It only happens when there is an increase in hormone levels, and this hormone is the estrogen. So the myth of believing that sexual intercourse causes vaginal loosening is not true, because all the widening of these vaginal walls is controlled, number one, by the mindset, and number two, by the hormones, and number three, by the production of this vaginal fluid. When there is vaginal fluid, then automatically there will be a very slippery surface for sexual intercourse. Now, my main point was this issue of maybe shaming women with the beliefs of that sexual intercourse or multiple sexual partners or regular sexual intercourse ends up making your vagina to become loose should stop, because that is not true. We only expect vaginal widening after childbirth and after estrogen levels have gone down, and that is mostly in people who are above 40 years. And this issue of vaginal widening after childbirth it's not permanent. I want to say that there is also another pathological cause of vaginal widening, and that is when maybe there is NDCs. And I want to say this, that having a tight vagina, it's not a reason for you to smile, because when the vagina is so much tight, it leads to vaginismus. So vaginismus is a condition. When your vagina is too tight, that hence up to you experiencing pain during sexual intercourse. That one does not mean that you do not have multiple regular partners, or you do not have regular sexual intercourse. It simply tells us that you have a problem that should be treated. Another issue is that all these cause, even after childbirth and even after you get into your 40s and the estrogen levels drops, there are also treatments that can be given to make sure that your vagina does not lose the previous shape, or it does not appear to be so wide. In this case, we can try to boost your estrogen hormones. We try to give you estrogen hormones. We can also try to do surgical procedures that we refer to as vaginoplasty, to make sure the shape of your vagina is reconstructed back to the shape, and maybe to make it a bit tight. And there are also some exercises that helps in regaining the previous shape of your vagina. If this is the very first time you are coming across this channel, please consider to subscribe. You can also share this video, like, and also leave your comment down there. Until next video, I sign out.